Thanks for tuning in today. I'm Dr. Nick, the Incrementalist. Join me as I seek out the small incremental changes being applied in other industries that we can learn from and that can be applied in healthcare. Can these changes bring immediate value, but also add up to the big improvements and revolution we need in healthcare? Come along with me to explore the possibilities. My innovative guests from around the globe have used small incremental improvements to achieve their moonshot. And today, I'm delighted to be joined by Marla Hetzel. She is the Director of Innovation and User Experience at Change Healthcare. Marla, thanks for joining me today.
Oh, thanks for having me here.
So we met as a result of a presentation you gave at Health TechNet. That's a group that I participate in the local DC metro area. You talked a lot about the interactions with people and the challenges that we have. Tell us a little bit about your background and how you arrived at this role at Change Healthcare.
Sure. I've spent the majority of my career in product development and market research, mostly in healthcare, but a few other industries as well. And my background in product development and market research was really a very natural path to bring me into innovation, as innovation became increasingly popular, if you will, in recent years. So a couple of years ago, I was working at a nonprofit in Washington, D.C. in the healthcare space, and an innovation position opened up. And it was right about at the same time that design thinking and user experience was becoming far more popular, and I just fell into it. But it was a very natural falling into because of my background. And most recently, having joined Change Healthcare about a year ago, I certainly brought those skills with me, and I'm also teaching others. So working inside the company to teach others how to practice innovation, how to build a user-centered perspective, and how to be innovative and think differently about how they work and the work they do.
And I think from a listener perspective, I know some of the folks that I engage with, they're going to be very excited to sort of hear you talk about that engagement and the need to focus on that individual, the patient. You really sort of get down to that as the basis, essentially, for the work of healthcare and how you approach that.
Yeah. It's remarkable how many times the patient isn't considered in the big equation, except from a clinical perspective, right? Certainly.
Right.
And it's not limited to the patient. You also have a very healthy ecosystem in the healthcare industry. You have the patient, you have potentially a caretaker, you have other family members, you have the clinicians and others who are involved. So it can be quite complicated. You know, at Change Healthcare, we define innovation as change that delivers relevant value to the user. And the user can be a customer, a patient, a partner. It could be an internal user, you know, somebody we work with inside the company. And it's about delivering value to those people. And it doesn't matter if we think something's innovative. What matters is if they think it's innovative. Did they, in fact, perceive and receive value? And that's the measuring stick for innovation.
It's extraordinary, isn't it? So, the fact that that's not considered as part of healthcare is almost sort of, what were they thinking as part of that process? Why does it need us to even say that? Shouldn't that have been a sort of foundation? But I think part of what you had shared in the presentation was some of the struggle that people have with that approach. It's not sort of innate to us, right? It's something of a mindset issue that, you know, we struggle with as humans, essentially, right?
Oh, yeah. Oh, I could talk a long time about mindset as it relates to innovation. We've got us humans have a lot working against us when it comes to innovation. Our brains are wired for predictability, right? So as people, we want stability, we want predictability, and we want to see things in the world that conform to our understanding of the world. So when we work in innovation, that's not innovation. Innovation is non-routine. It's generally not predictable. It actually doesn't necessarily conform to our understanding of the world. So it makes it difficult for some, maybe to one degree or another, to navigate innovation and to learn the lenses that help us see things through through the user's perspective. And when I say user, I'm going to use that as a general term to account for patients, family members, what have you. But I think a big part of it, probably first and foremost, especially when it comes to the user-centered perspective, is empathy. So empathy is a foundational component of human-centered design thinking, user experience. And empathy, people think they understand empathy. I thought I understood empathy. And when I came in to change healthcare a year ago and really started to better understand our internal content and our internal training around empathy, I realized I didn't understand it nearly as well as I thought I did. So even though I have a number of years of experience behind me, I'm still learning about how to be the best practitioner of innovation that I can be. And I think empathy is a place where a lot of people don't necessarily understand it or how to practice it. And there's two components there. There's the skill of empathy, active listening, observation, asking open-ended questions and probing, so we can use those hard skills, those techniques, to understand the user's perspective. But the other piece of that is the soft skills. It's the mindset. It's the perspective. And if I can elaborate a bit, so empathy is about getting close to the people we're solving for and really understanding what's valuable to them. It's foundational, as I mentioned earlier. And when we think about empathy, we think about how do we look at it through the lens of somebody else. And this is a really important distinction from sympathy. So if I'm sympathizing with you, I might say something like this: "Oh, I'm sorry. I know how that feels. I remember when that happened to me too." What happened with each of those scenarios? I made it about me, didn't I? I started to talk about myself. And when I start to talk about myself, I introduce bias. Sympathy oftentimes is looking at something through your own eyes, not someone else's eyes. Whereas empathy is truly looking at it through the other person's eyes. And that means, to the best of one's ability, putting aside our biases and really kind of opening ourselves up to discovery, to not knowing. And that's hard for people to do because, especially in healthcare, we're experts, right? Clinicians have been very much trained to be experts. The people, the administrators and the others who work in the healthcare industry, we're experts about healthcare. So it's hard for those people who really value that expertise and have been so well trained to kind of let go of that and look at something through someone else's eyes for a short time, but that looking at it through another's perspective is really a critical, it's the definition of empathy, and it's important to innovation.
So I remember this vividly from your presentation, and it really struck me and struck a chord, because I know inherently in my own interactions with patients and, the desire, we all have a desire to be empathetic with our patients, the communication of bad news. And I as I sort of looked back, I'm thinking, I probably wasn't that empathetic, because I would relate it to my own experiences immediately about me, hadn't occurred to me. And
right.
What I struggled with was, how do you change that? I mean, it's built in. It's not, it's not an action that, I'm taking because I want to make it about me. I'm just doing it as a natural tendency. How are you helping people shift that approach?
Yeah. Well, at Change Healthcare, we're teaching them those hard skills. So we're teaching people how to be active listeners, and we really dive deep into what is active listening and how do you paraphrase content and reflect feelings. We teach people how to ask open-ended questions, how to probe, and importantly, how to observe. So observation is more than just kind of looking around the space. It's truly seeing what's happening as you're interacting with your users. So from a skills perspective, we highlight the importance and we teach those skills for empathy. And then we also explain to people exactly what I was just explaining to you. And a lot of people have that realization. They think, oh, I think I'm empathetic sometimes, right? Yep. I don't intend not to be, but I don't think I'm truly getting it. I conducted a workshop a couple of weeks ago and was talking about empathy, and I was talking about empathy versus sympathy, and then I was talking about the skills that I just mentioned. And somebody in the room asked me, he said, how do I know when like if I'm in an interview, how do I know, an interview of an end user, how do I know when I'm not being empathetic? And I said, geez, that's a really good question. And I thought about it for a minute. I said, well, you might start kind of thinking about your own experiences. That's an indication that you're starting to see it through your eyes, not theirs. And then somebody in the room raised their hand and he said, I used to be a therapist in a previous life, he was saying. He goes, and I think you feel it physically when you stop being empathetic. And I thought that was a really important point he made, because in my own training around empathy, when I am truly being empathetic and leaning into that conversation and listening to the other person and really putting my own perspective and my own biases by the side, I'm vulnerable. I can feel it. Like I can feel it physically. And so when that person who had the past life as the therapist said that about the physical, he feels it physically, that really resonated with me. And I think until you really start practicing empathy, and really understanding it, it's hard to get your head around it intellectually. It's about a practice and it's about a mindset. And for anyone who's interested in building their innovation capabilities, I would strongly recommend that they really understand empathy and learn how to practice it and feel it, as that therapist in the room that day was saying.
So it brings up a question that I have around this, and it's one of the sort of experiences I had as a clinician, which was, if you really do, and I think that's a great way to assess yourself if you feel it, but what I learned was that was not only made me vulnerable, and that wasn't the bad part of it, it was the excessive amount of vulnerability because of the large numbers of people that I was dealing with at that end of that spectrum. So how do people reconcile that? Because you want to be empathetic, but at the same time, if it impacts you that much, are you going to end up, it raises the issue of burnout. Is that part of what contributes to that sort of burnout issue?
Well, I think that's a really good question, and I don't know if I necessarily have an answer for it, but what I'll say is this. In the practice of innovation, you might not have as much exposure as you would if you were a clinician, right? So when we go out and do empathy interviews, we're going in as teams. So first and foremost, you have the support of your team members. So if you feel like it's becoming too much, you can always switch roles on the team and maybe take a little bit of a back seat, if you will. So you can use the support of your team, but we also limit the number of interviews we do to a certain number. So at some point, your interviews come to an end, your observation comes to an end, and then you go and make sense of what you learned, which is the second phase of design thinking. So that exposure has boundaries in the practice of innovation. Whereas I think if you're a clinician or another practitioner, you may have more of that. Yeah. And I think you would have to look to your team members to help you navigate through it, much like we would do in innovation. And there are some team members who experience what you just talked about. In fact, one of my colleagues, she and I were talking about it recently, and she was talking about how sometimes she does have to kind of take that back seat and play another role because it's just too much for her to take in one day, for example, if she's conducting a number of interviews.
So for those of you just joining, I'm Dr. Nick, the Incrementalist, and today I'm talking to Marla Hetzel. She is the Director of Innovation and User Experience at Change Healthcare. We were just talking about that whole empathy and really sort of leaning in and stepping into the shoes of the individual and the challenge that returns. And I think just outstanding advice, irrespective of the innovation piece, but from a clinical standpoint, that support infrastructure of your team and the ability to share and limiting how much, so I think some good guidance in some other areas of clinical medicine that we can apply. So one of the things that you related as part of your discussion around this was the process by which people sort of innovate. And I vividly remember your story about the comedian and how that sort of approach is. Tell us a little bit about this, because it really lends itself to the process and how we can sort of guide that, because I think we all assume it's this, eureka moment, but it's not, right?
No, it's very iterative, very iterative. And that's another area where not everybody has comfort. In innovation, especially if you're dealing with something closer to breakthrough or radical innovation, you're not going to get it right the first time, which brings up the topic of failure, which hopefully we'll get to because that's a whole nother issue we have to deal with in innovation. But when we talk about iteration, it's really innovation unfolds with small steps. I remember I read that somewhere. I don't remember where I read it, but when I read that a few years ago, it really struck me. Innovation unfolds with small steps. It doesn't occur at one time, to your point, and it's really through the iterations and the learnings that eventually become reorganized into a framework for an idea or for a new solution. And I think one of the fascinating things about innovation is that's sometimes really hard to see in the beginning, right? So that iterative process takes you through many steps and learnings that sometimes you can't even imagine you're going to have. And in that story about Chris Rock, it came from a book by Peter Sims called Little Bets. And I love this story because Chris Rock is brilliant, right? He's a brilliant comedian. And I just thought he created a comedy act, right? But in fact, he goes through a very iterative process. And in the book, the author talks about how Chris Rock will, when he's got ideas, he'll go to these low-key, small comedy clubs, and he'll make these impromptu appearances. And imagine this, he carries a notepad. So he's got a notepad with a pen. He's got all of his ideas jotted down, and he'll informally perform, paying close attention to the audience and how they respond. And he watches them. He watches for when they laugh. He watches for when they don't laugh. He watches for when they frown. He's constantly monitoring their reaction. And he does this over and over again. In fact, I read, if I remember right, I could think it could take him up to a year to produce an act as he goes to these comedy clubs and just continuously, iteratively presents, gets feedback, and iterates. And I love, in particular, the book said that he's testing, he's refining, and he's repeating, and he's getting armed with better and better information. But what's important is he might think he has the best joke, right? He laughed all the way to the comedy club that night thinking about this joke. But if the audience doesn't laugh, that's his new reality. Right? That's his new reality. And the opposite holds true. He may think a joke is going to fall flat, and they roar with laughter. And so going back to what I said earlier about seeing it through the user's lens, right? Innovation is about value delivery to that user. Right. He's looking at his audience. So it doesn't matter if he thinks the joke is funny. It doesn't matter if he thinks the joke is going to fall flat. What matters is how they respond to it. And because he's taken that iterative response or that iterative approach, it's not one audience one night. He's continuously engaging with his user and taking that iterative approach, putting out his tests, getting feedback, and iterating. And he does this for upwards to 9 to 12 months to develop his app. And it was just fascinating to me when I read that story.
And I think the other aspect that I remember from that was that it could be even individual words in a joke. So changing single things as part of that process. So it's not these big changes. And, sometimes, as you described, the sort of fall flat and then the surprise of the things that do work. And there's so much to learn from that, because I think that applies everywhere. This idea that, it's this big eureka moment just doesn't follow through. And that's true for innovation. So how do you impart that to the folks that you're trying to train as you go through that process? And specifically, I think one of the things that, is central to this, and I hear this a lot on the show, is that failure and that spectrum of failure.
Yeah. I think, there's a lot happening inside companies that work against innovation. Companies aren't built for innovation. They're built for operations, right? So companies too. So we've talked a lot about people understanding empathy, people understanding iteration, but companies need to do so as well. And failure is a really big issue, and failure is a really big issue for lots of reasons. I mentioned earlier our brains. Our brains are not wired to fail, right? Our brains don't want to fail. As children, we're taught not to fail, right? Right. We're taught to blame. In fact, failure for some people, even well into adulthood, can trigger very painful emotions, depending upon their experiences in life. As we become teenagers and young adults, we're further trained not to fail. I mean, if you go to class and you get a bad grade, that is not a good thing, right?
Right.
And then we come into this business world. And when we get into the business world, whether it's a hospital system or elsewhere inside the healthcare industry, they're built for efficiency. We're saving lives. Failure is not good because somebody may die, right? So healthcare adds another layer of complexity on because of the, potential high risk associated with it. So when we talk about failure, though, a lot of people see it as black and white. So they look at failure as, it is or it isn't. And that's actually not an appropriate way to look at failure inside organizations. And there is a spectrum. This is research that was done by Harvard Business School, where they looked at, they studied a number of companies and they looked at a spectrum of failures. On the one end, you have failures that are blameworthy, right? They do exist. And on the other end, you have failures that are praiseworthy. So on the blameworthy end, you might have something like deviance or inattention. But when they talk to executives reported that those types of failures are the minority. They most likely happen in single digits, whereas most failures are maybe not praiseworthy necessarily, but they're certainly not blameworthy. But when we look at the praiseworthy end of the spectrum, you've got, exploratory testing, hypothesis testing. You have other types of experiments being done. These are all things we do in innovation. And so really, I think companies, I thought this, when I found this article a couple of years ago, I just thought it was fascinating because too often inside companies and on teams, it's that black and white. It's like it failed, it didn't, right? It's good, it's bad. Where the reality is there's a much broader conversation we have to have about the type of failure it is, and most importantly, what we can learn from it, right? Failure is not the end. That's not what we're aiming towards. It's going to happen in innovation, but what can we learn from this, and how do we build on our learnings? And that is absolutely critical to innovation and something that I don't think gets enough attention inside companies.
So, that's a sort of central tenet to this incremental approach and, the challenge of sort of accepting failure. One of the things that I hear repeatedly in this show is, take your initial idea and expect it to be a failure.
Yeah.
You look at these innovation places like DARPA, where, lots of money invested, and they expect 90% of those ideas to absolutely amount to zero, nothing at all. So in the last minute or so, tell us how you help people overcome that. What is it that you can share with folks that will allow them to sort of step over the line, or at least take that incremental step towards, acceptance of it?
Yeah, I think it becomes one of the recommendations we make most frequently is start talking about it. We've all experienced failure. We have all experienced failure. So how can we start a conversation about it and get more comfortable talking about it? So I had some of the executives doing a roundtable about innovation a couple of months ago. And at the end, I said to them, when we were crafting their speech, I said, at the end, talk about a failure you had in innovation. So that the employees, the workforce, can hear these high-level executives like a chief design officer and a senior vice president saying, here's the failure I experienced and here's what I learned from it. So I think number one is start talking about it openly as leaders and as team members working on teams. And I think the other one too is as you experiment and you experience failures, invite others in to make sense of what you've learned and open yourselves up to discussions with others to help enhance your learnings. So I think it's largely about starting a conversation. Yeah.
Fantastic. So as usual, we've run out of time, unfortunately. I think some fascinating insights into that process. I think lots to learn from this. Very excited that, this is even occurring in some companies, and, folks like you bringing that insight and, thought process to the process. So Marla, it just remains for me to thank you for coming on the show. It's been a great pleasure.
Oh, thank you for having me. I enjoyed the conversation.
Thanks for joining me today. Do you have any better ideas, or have you found a small incremental change that's brought about a big improvement in your world? Let's continue the conversation on our hashtag, The Incrementalist, or share with me at DrNick1 on Twitter. You can find more information about the show on our program page at healthcarenowradio.com. And tune in next time to hear my discussions with leaders and innovators from around the globe who've revolutionized their space by using small incremental improvements to achieve their moonshot. I'm Dr. Nick, the Incrementalist, and I'm starting a revolution through evolution.